Welcome! You're now in the den with Dr. Jenn, a safe and comfortable place to explore female sexuality from a variety of perspectives and start thinking about sexuality outside the box. Our den chat topic, Kegel exercises and the PC muscles. So actually this den chat topic is actually very focused on the box today. What are the PC muscles? The PC muscles are actually a band of muscles that stretch between the legs of both men and women, stretching from the pubic bone in front to the tailbone in back. These muscles are clinically known as the pubococcygeus muscles, but as you can see, that's a real mouthful. And so the group of muscles are usually called the PC muscles. And they actually act as a hammock, holding in our pelvic organs. And you can isolate these muscles to strengthen them. So how do you isolate these muscles? The usual advice that I've always heard and read about this is to isolate them while you're urinating. So you're sitting on the toilet, legs slightly spread, try to interrupt the flow of the urine without bringing your legs together. Stop and start the flow, trying to sense those muscles that are involved. Once you can control the flow of your urine, you can also find and squeeze them when you're not on the toilet. You have identified this band of important pelvic floor muscles. Or other advice that I found, which I think is very helpful, if you don't want to do it while urinating, you can place your finger inside your vagina and squeeze around it. When you feel the pressure around your finger, you've located the correct muscle. Now remember, these muscles aren't located in your abdomen, they're not in your thighs. I think probably about at least a third of women, when they first try to do this, they're not actually isolating the right muscles. So you want to make sure you're not tensing anything else up but that muscle area. Okay, so what are Kegel exercises? These are exercises that specifically contract the muscles, and you can tighten them for a slow count, a lot of times up to 5. At first you may not be able to do it to 5, but keep trying. Your goal over a period of a time is to increase the number of contractions and the length of time held. Although there is a limit to which the PC muscles can be tightened before they automatically begin to relax. And it's actually, if you do it, it's a really funky feeling because it kind of just relaxes on its own. I just did 5 of them right there. But if you work at it each time, striving to improve your count, it'll work for you. If the muscles feel tired, that's fine, just stop and relax. I commonly hear that it's a practical plan to do them while driving, a series of contractions at each stoplight or at each gas station you pass, or in response to some other reminder, watching television, whatever. But I've also read elsewhere that they work best with 5-minute sessions done twice a day. So maybe not so randomly, and actually just very defined 5-minute time periods. And why do you want to do this? That was an awful lot of talk, and you don't even know why. It's a really important muscle group to tone before giving birth, to restore muscle tone after birth. If you have any problems with bladder control or urinary incontinence, it can increase your control over your bladder. And also, it can increase your ability to and intensity of orgasms. Woohoo! So keep a calendar. Give yourself a check mark or a star each time you do the exercises. This will help you keep track of when you started and keep you motivated.